Okay, so we're diving into news articles today about a shooting.
Oh, wow.
Yeah, it was just yesterday, February 22nd, 2025, at UPMC Memorial Hospital in York, Pennsylvania. Yeah.
It's interesting. This wasn't just random violence. It seems like a chain of events led up to this,
Yeah, and from what I've read, this 49-year-old man named Diogenes Archangel-Ortiz entered the hospital's ICU with a gun and zip ties.
Oh, wow.
That detail stuck out to me, like he planned this.
Absolutely. Those zip ties suggest that he intended to restrain people and gain control.
Yeah.
And tragically, that's what happened.
Yeah, he took staff hostage in the ICU.
Yeah.
And it's just hard to imagine what those workers went through. The ICU is already intense dealing with critical patients.
Yeah.
Then to be confronted with this.
It's truly a nightmare scenario. And to make matters worse, it escalated into a shootout with the police.
Yeah.
Officer Andrew Duarte, a 30-year-old responding officer, was killed in the gunfire along with Archangel-Ortiz.
And several others were wounded, too.
Yeah.
A doctor, a nurse, even a custodian.
It's a reminder of the dangers they face.
Yeah, anyone nearby can become a victim.
Right.
So let's talk about Officer Duarte.
Yeah.
I was reading that he was a law enforcement veteran, 5 years with the Denver Police Department.
Oh, wow.
Then joined the West York Borough Police Department in 2022. And he received a Hero Award from Mothers Against Drunk Driving in 2021.
That's amazing.
Do we know what he did to earn that?
The details surrounding that award haven't been made public, but it shows his dedication to service, going above and beyond.
Yeah.
And his LinkedIn profile mentions he's a Type A personality, someone who thrives on success. And his colleagues speak very highly of him.
It sounds like his death is a huge loss for West York.
It is.
Especially under these circumstances.
Yeah.
So now let's shift to the motive.
Okay.
What stood out to me is that Archangel-Ortiz seemed to target the ICU specifically. He was there earlier in the week visiting someone, and something must have happened during that visit.
Yeah. The York County District Attorney Tim Barker mentioned that Archangel-Ortiz had some kind of contact with staff during the visit, and it hadn't gone well. But exactly what happened and his motive remain under investigation.
Yeah. The ICU is often a place of heightened emotions and difficult decisions.
Right.
Makes you wonder what kind of pressure cooker situation might have unfolded during that previous visit.
Yeah.
It's chilling.
It is.
And I want to see where this piece of the puzzle fits.
Yeah.
Sadly, this isn't an isolated incident.
No, it's not.
This shooting at UPMC points to a larger trend of violence in healthcare settings.
That's right. Hospitals, places meant for healing, are increasingly becoming targets.
It's scary.
The CDC even found that healthcare is one of the most violent professions in the U.S.
Yeah.
Workers face a disproportionately high risk of injury from workplace violence.
4 times more likely than workers in private industry.
Yeah.
That's a staggering statistic.
It is.
And the articles you shared highlight other shootings at hospitals, too. This can't be ignored.
No.
We need to take a deeper look and ask, what more can we do to protect these workers who are already dealing with so much?
You're right. It's a complex issue. And while people discuss security measures like, increasing security, we have to consider the downsides, too. Could it create a hostile environment for patients and their families?
Yeah.
It's a balance to strike.
For sure.
Maybe preventative measures addressing the root causes might be better long term. What are your initial thoughts?
It's clear we need a multifaceted approach.
I agree.
But before we discuss potential solutions, let's get a sense of the community response in West York.
Okay.
What's the atmosphere like there after this tragedy?
Well, it's heavy with grief, but there's this outpouring of support and unity.
Yeah, I've seen photos of flowers and candles at the police department.
Right. It really speaks to the close-knit nature of this community.
Yeah.
They had a candlelight vigil, too. Drew hundreds of people. It was powerful. Show of grief and support for his family and colleagues.
It's heartwarming, to see that amidst such tragedy, there's this sense of community.
Right.
So let's shift back to this trend of violence against healthcare workers.
Okay.
You mentioned it's complex with many factors.
It is.
So what's driving this surge in violence?
Well, hospitals are often dealing with people in crisis, facing illness, injury, mental health challenges, substance abuse.
Right.
These situations are unpredictable and can become volatile.
Makes sense that working in that kind of environment would mean a heightened risk of encountering violence.
Exactly, and it's not just the patients themselves.
Right.
Long wait times, overcrowded ERs, staffing shortages.
Yeah.
They all add to a pressure cooker environment,
Yeah.
Frustration and anger among families and visitors.
Wow. So healthcare workers are facing a lot daily.
They are.
Sounds like a system under strain.
It is, and we can't overlook the broader societal issues, too.
Like what?
Well, the rise of gun violence and a decline in civility contribute to a climate where violence is more likely even in places meant for healing.
It's sobering that these issues impact healthcare settings so much.
It is.
So what are hospitals doing to protect their staff?
Hmm.
Are things like metal detectors and security guards effective?
Well, those measures are important, but hospitals are complex with many entry points.
Yeah.
Like trying to secure a small city.
Yeah.
It's difficult to completely eliminate risk.
Right.
So many hospitals are now focusing on preventative measures and de-escalation.
Okay.
Training staff to recognize warning signs,
Yeah.
de-escalate tense situations, and protect themselves.
So it's not just physical security, but giving staff the skills to handle these situations.
Exactly. It's like they need a whole new skill set
Yeah.
to navigate this volatile environment.
Right, and that's where this trauma-informed care comes in, right?
Exactly.
Can you explain that more?
Sure. It recognizes that many individuals, both patients and staff, may have experienced trauma. And this trauma can affect their reactions in stressful situations.
Right.
So trauma-informed care trains staff to recognize signs of trauma, respond with empathy, and de-escalate without re-traumatizing.
Instead of just reacting to aggression, healthcare workers are equipped to understand the underlying cause and respond in a way that promotes safety for everyone.
Right.
It sounds proactive.
It is, and it's not just about staff and patients.
Yeah.
It also emphasizes creating a culture of support and respect in the workplace.
So healthcare workers feel safe too.
Exactly.
That's important. If they feel safe and respected, they'll be better able to handle these tough situations and provide compassionate care.
Absolutely. And this approach is gaining momentum in healthcare. It's long-term, it requires training and a shift in perspective, but it can create a safer and more supportive environment for everyone.
It's encouraging that hospitals are looking beyond physical security and exploring these more holistic approaches.
It is.
But it can't just be hospitals, right?
No, you're right. It requires a broader societal effort.
Okay.
Policymakers have a role too. Recently, there have been efforts to strengthen penalties for assaulting healthcare workers
Okay.
and provide funding for workplace violence prevention programs.
That's good. A step in the right direction.
It is.
It sounds like there's growing awareness and a willingness to address it from different angles.
Right.
What do you think about these policy changes? Will they work?
It's hard to say for sure this early, but I'm cautiously optimistic.
Okay.
These changes send a strong message and provide resources for training and support.
Yeah.
But true change needs a comprehensive approach. We have to address the root causes of violence in our society, invest in mental health, and create a culture of respect and empathy.
Right. It's multifaceted and demands a multifaceted solution.
Exactly.
Okay, before we move on, I want to acknowledge the weight of this topic. We're talking about violence loss and a disturbing trend, and I want to remind listeners it's okay to take a break if they're feeling overwhelmed.
Absolutely.
Self-care is important, especially with difficult topics.
I completely agree. No shame in stepping away to tend to your well-being.
Right.
These conversations can be heavy.
Yeah.
It's crucial to prioritize mental health.
So for the final part of our deep dive, let's focus on something more hopeful.
Oh.
The community response and resilience. We've discussed the challenges of violence in healthcare.
We have.
But it's important to highlight the positives, too, how communities come together.
I'm glad we're focusing on that. It's a reminder that even in the darkest times, there's hope and inspiring examples of human strength and compassion.
Yeah, it's those glimmers that can guide us toward a better future.
Right.
So let's take a moment to reflect, and then we'll delve into the inspiring aspects of this story when we return.
Sounds good.
We're back, and I'm ready to hear more about those glimmers of hope.
Yeah, the response in West York has been extraordinary. It's a small borough, so this loss feels personal to everyone. And they rallied so quickly to honor Officer Duarte and support his family and the police department.
We talked about the flowers and candles, the vigil, all beautiful expressions of grief.
Yeah.
Anything else stand out to you?
Well, one thing was the suggestion from council member Jennifer Chambers for residents to replace their porch lights with blue bulbs.
Oh, yeah. I read about that.
It's simple but powerful, right? A visual representation of their support for law enforcement. Driving through town and seeing all those blue lights creates a sense of unity, shared purpose in the face of this tragedy.
Yeah, it's like the whole community is wrapping its arms around the police department and Officer Duarte's family.
Exactly. And it speaks to the deep connection between law enforcement and the community there. Like, Officer Duarte wasn't just an officer. He was a member of their community, a protector.
It makes his loss even more profound.
It does.
I can't imagine what his family is going through.
It's heartbreaking. But even in their grief, they've shown such strength.
Yeah.
Governor Shapiro met with Officer Duarte's parents and the wounded officers, and he spoke about their courage and resilience.
I read that Governor Shapiro called Officer Duarte one of the best of us and praised his dedication.
His story shows the sacrifices that officers and their families make. Every day they put their lives on the line to keep us safe.
And we shouldn't take that for granted.
No, we shouldn't.
His family isn't alone in their grief. The entire community and really the whole state mourns with them.
Right, and Governor Shapiro ordered flags to be flown at half-staff in honor of Officer Duarte.
A fitting tribute.
It is a symbol of respect and a way for the state to acknowledge this loss. And it sends a message of support to all law enforcement. Their work is valued and their sacrifices aren't forgotten.
As we wrap up this deep dive, I keep thinking about resilience. We've seen in the first responders and Officer Duarte's family and the West York community.
It's a testament to the human spirit. Our ability to find strength amidst adversity, to come together when things are tough. It's inspiring.
It really is, and it reminds us that even in the darkest times, there's hope, there's light. This deep dive has been difficult exploring this tragic event and this unsettling trend, but amidst the darkness, we've also seen compassion, courage, and community.
It's true, and it's important to remember that these tragedies, while heartbreaking, can also be a call to action.
Yeah.
We can honor Officer Duarte's memory by working to create a safer world for healthcare workers, a world where communities stand strong and united, and a world where violence isn't the answer.
So let's carry that message with us. Let's channel this grief and outrage into action, working towards a future where tragedies like this are a thing of the past. Thank you for joining us for this deep dive.